Imagine you were a patient lying in a hospital bed and you overheard your nurses in the hallway saying, "I feel like I don't have my patients anymore." I speak from personal experience when I say this is a real possibility for us as nurses in our efforts to try to provide our patients with the highest quality care. My name is Tiffany Kelley, and I am the founder and CEO of Nightingale Apps. Over my 14 years as a nurse, I've had days where I've really knew my patients, and they got excellent care. But there were days where I didn't know all of my patients very well. And at that point, I was never fully confident that the care that I had delivered to them was what they deserved and what I expected of myself. So you might be thinking to yourself, how is this possible? Nurses receive extensive education and training over the course of their career. Our hospitals are filled with diagnostic tools that are top of the line. And now we have electronic health records that are multi-million-dollar systems embedded within our hospital settings. Well, as nurses, building relationships is the start of knowing the patient. But at the core of that is really knowing clinical and personal information about our patients. And that starts with what we call shift report. That's the first 30 minutes of our day where we have that time to work with the other nurse and get all the information we need to care for our patients. This is a verbal transfer of information from one nurse to the next. And if I have 5 patients, I have about 6 minutes to get everything I need to know. On the receiving end, I'm actively trying to capture all of that information onto my supportive device. Now, in the technological age that we live in today, I'm sure you're wondering, well, what does this look like? It looks like this, including hospitals with electronic health records. This is consistent with my practice. This is consistent with every nurse I've worked with, as well as the 400 hours I've spent watching nurses provide care to patients in hospital settings. We keep this sheet of paper in our pocket, and this is our lifeline to provide care to patients. But it's fraught with potential for error. There's risks of transcription error, safety for the patient, and at this stage where we are technologically, we must have a better way to be able to address this for nurses. Now, with the inclusion of advanced clinical information solutions and advanced technologies, we're now using this device to transcribe information at the bedside and save it here onto this sheet of paper. Well, what can we do about this? Well, we've got computers at the bedside, sometimes, computers at nurses' stations, and computers on the walls. But as a nurse, we're always mobile. We're not always where these places are. So in the research I did, I realized something. Every nurse has their own smartphone in their pocket. This is with them wherever they go. We need to do something about this, and how can we do this? And that's where I founded Nightingale Apps. The Nightingale app is called Know My Patient. Know My Patient is a mobile application designed to support nurses working in hospital settings to provide safer, more efficient, timely, and patient-centered care through the use of expert workflow models. Our patent-pending technology is approximately 2 months away from prototype completion, and we're actively seeking out our first pilot site to test and validate our concept. At this point, we do realize there are some competitors in the mobile space. However, from our assessment, the competitors aren't addressing the nurse's needs from the very beginning of the day all the way through to the end, at a comprehensive level, to be able to have those nurses then say again, "I know my patients today." I look forward to speaking to any of you that would be interested in learning more about our company, and thank you very much for your time.